R.M. Saya, Honorable Chief Justice, Guwahati High Court, Sri Keshav Mahanta, Honorable Minister, Health and Family Welfare, Government of Assam, Mr. Justice N. Koteshwar Singh, Honorable Justice, Guwahati High Court, Mr. Justice Suman Shyam, Honorable Judge, Guwahati High Court, Sri Abhinash Joshi, Principal Secretary to the Government of Assam, Health and Family Welfare Department, Sri Manoj Bhimani, Managing Trustee, Prasanti Medical Service and Research Foundation. Ladies and gentlemen, in the field of healthcare delivery in Assam, today is a historic day. The signing of Memorandum of Understanding between the Health and Family Welfare Department, Government of Assam, and Sri Sathya Sai Heart Hospital, Ahmedabad and Rajkot, run by Prasanti Medical Service and Research Foundation, Ahmedabad, heralds a new beginning for treatment of various cardiac disease among the poor and the needy peasants of the state. As per this Memorandum of Understanding, children and adults from Assam belonging to the disadvantaged group of society who are suffering from cardiac ailment will be provided treatment free of cost, including surgeries at the Center of Excellence run by PMSRF at Ahmedabad and Rajkot. On behalf of the people of Assam, I'd like to convey heartiest thankfulness to Sri Manoj Bhimani ji, Managing Trustee, Sri Sathya Sai Heart Hospital, Ahmedabad and Rajkot, who has come all the way from Gujarat to take part at this event, and the authorities of Prasanti Medical Service and Research Foundation for coming forward to support the state in extending quality treatment to the patient suffering from heart ailment. মই অসমবাসী ৰাইজৰ হৈ আজিৰ দিনটোত প্ৰশান্তি মেডিকেল সাৰ্ভিস এণ্ড ৰিচাৰ্চ ফাউণ্ডেশ্যনৰ মেনেজিং ট্ৰাষ্টি মনোজ বিমানী ডাঙৰীয়া আৰু এই হস্পিটালৰ সৈতে জড়িত আটাইকে ধন্যবাদ আৰু কৃতজ্ঞতা আগবঢ়াইছো। ইতিমধ্যে আমি সকলো অৱগত হৈছো যে ৰাজকোট আৰু আহমেদাবাদ গুজৰাটৰ দুখন প্ৰধান চহৰ, যাৰ লগত গুৱাহাটীৰ বিমান যোগাযোগ অত্যন্ত সহজ। সেই স্থানত থকা দুখন অত্যন্ত সুন্দৰ হস্পিটালত অসমৰ 1000 গৰাকী দুখীয়া পেচেণ্টক কাৰ্ডিয়াক এইলমেণ্ট, হৃদয় ৰোগৰ সৈতে জড়িত বিভিন্ন সাৰ্জাৰী বিনামূলীয়াকৈ সম্পন্ন কৰা হ'ব। আমি সকলো অৱগত যে আমাৰ ৰাজ্যখনত যথেষ্ট হৃদয় ৰোগত আক্ৰান্ত শিশু আছে, যাক আমি CHD বুলি কওঁ, কৰনেৰী হাৰ্ট ডিজিজত আক্ৰান্ত ল'ৰা ছোৱালী আছে, আৰু যথেষ্ট দুখীয়া লোক আছে যোনে ব্যয়বহুল মেডিকেল খৰচৰ বাবে তেওঁলোকে অস্ত্ৰোপচাৰৰ পৰিৱৰ্তে কনভেনচনেল মেডিকেল ট্ৰিটমেণ্ট লৈ জীৱন যাপন কৰিবলৈ চেষ্টা কৰে। ভগৱান শ্ৰী সত্য সাইৰ প্ৰেৰণাৰে উদ্বুদ্ধ হৈ আজি আমাৰ অসমবাসীৰ বাবে গুজৰাটৰ পৰা এই সুন্দৰ খবৰটো আহিছে যে 1000 দুখীয়া লোকক তেখেতসকলৰ চিকিৎসালয় সম্পূৰ্ণ বিনামূলীয়াকৈ ট্ৰিটমেণ্ট কৰা হ'ব। অসম চৰকাৰে এই মহৎ মহিয়ান প্ৰচেষ্টাৰ লগত সংগতি ৰাখি আমি সিদ্ধান্ত লৈছো যে পেচেণ্ট আৰু এটেণ্ডেণ্ট সকলক আহমেদাবাদ বা ৰাজকোটলৈ অহা যোৱা traveling allowance বা বিমানৰ টিকেট আৰু তাৰ লগত জড়িত আনুষংগিক খৰচসমূহ ৰাজ্য চৰকাৰে বহন কৰিব। So it will be a partnership between the Satyasai Hospital and Government of Assam. Entire medical expenditure will be taken care of by the hospital authority. Traveling allowances will be made free by the Government of Assam. আমি সকলোৱে জানো যে 2009 চনত আমি এটা বস্তু চিন্তা কৰিছিলো যে আমাৰ ৰাজ্যত বহুতো শিশু আছে যি CHD ৰোগত আক্ৰান্ত। সেই সময়ত অসমৰ পৰিৱেশ বেলেগ আছিল। আমি বিচাৰিলেও অসমত এই ধৰণৰ সাৰ্জাৰী সম্ভৱ নাছিল। In 2009 we did not have any facility even for adult cardiac surgery. So what we did at that point of time, we talked to Dr. Devi Sethi. We impressed upon him that you do a surgery on a CGHS rate. We'll send patient from Assam. We'll take care of their lodging, their traveling expenditure, and we'll also clear their bills. So that process continued, and till today we have almost completed 9,700 or 800. I did not ask my people last month data, but we hope to touch in the month of February 10,000 marks on free cardiac health surgery program run by the state government of Assam. During this process, during this period, we have also developed our capacity to conduct such surgery, and today this MoU which we had initially only with Narayan Hridayalaya today also extended to various local hospitals in Guwahati, and today we are having more capacity to conduct the surgery without much waiting period. But we did not have such collaboration for adult heart surgery, and also in any way all our endeavor was a paid endeavor. We have to pay some consideration whether it is a big or small. At the initiative of our own, the Honorable Chief Justice of Guwahati High Court, Sri R.M. Sayaji, we got into touch with the Satyasai Hospital, and the hospital authority has offered that they will be able to do free treatment for 1,000 patients. And of course, this is for 2 years, but this partnership will go on, and probably the number will also increase in days to come. I, on behalf of the people of Assam, wants to convey our deep gratitude to Satyasai Heart Hospital Authority and Prasanthi Medical Service and Research Foundation for their noble gesture. We have seen that primarily the responsibility of judiciary is to dispense justice. We have in our democracy clear separation of powers, and normally treating patient or managing patient, managing healthcare education falls in the domain of executive. But sometimes we also see welcome deviation from the tradition. When we respect our own field and we do not engage in any personal negotiation or any give and take, but when we inspired by higher ideal of service to mankind, I think that then this separation of power, the wall between the authorities become thin and thin. From the day of Honorable Justice R.M. Saya joined in Guwahati High Court, he has taken one landmark initiative on education. He gave us a concept on school on wheels. We also used to neglect the children who are in the street deprived from education. He encouraged us to take up the project on school on wheels, and today we are running that project successfully. Thereafter, he has also guided us, inspired us to take certain innovative steps on the improvement of prison condition. Today, this is his third initiative with state government of Assam. He is doing so many things within the High Court, within the judiciary, but with the executive. This is his one more contribution. He is demitting office on 10th. I am sure that he will go back from Assam with a very fond memory, and will Assam as a grateful state will always remember his contribution, his tremendous contribution in just this short tenure of his service as a Chief Justice of Guwahati High Court. I am not competent to comment on the reforms or the initiative he has made within the judiciary, but we thought during this period of small interaction with executive, we are blessed, we are inspired, and I would like to record our deep sense of appreciation to Honorable Justice C. R.M. Saya. This initiative is inspired by philanthropy. যেতিয়াই একোজন সফল ব্যক্তিয়ে জীৱনৰ এটা মূৰত থিয় হৈ পিছলৈ উভতি চাই, তেতিয়া আমি সদায় দেখা পাওঁ যে life was all about myself, about my family. পৃথিৱীত এনে খুব কম মানুহৰ জন্ম হয় যি এটা সময়ত চিন্তা কৰে যে I did everything for my family, now let me do something for myself, for my soul, for purification of my soul, because when I will die, I have to give a count of my life to that Almighty who is ready with the accounting slip, what we did, what we have failed to do. People do realize at some point of time, but realization of this in the prime time make it healthy and make it constructive. Otherwise, when I realize this bitter truth at 70 or 75, except a sense of apology, sense of guilt, we can't do nothing. So, right time, right thought should come. But for that also you need blessings of God. Because even without blessings of God, good thought process also doesn't come to one's mind. Or even it comes to your mind at some moment, it will again go out, because at any time you are engaging with the nature, you are engaging with the Prakriti, and Prakriti is always there to defeat the purpose of our soul. They will always try to poison or give something that we do not go back to the God's feet. So it is a struggle between the various level of rule of Prakriti. We have Ripu, we have many other things. There is a constant engagement, and if we still can defeat those and come out a little bit, then we will be near to the God and we will know for what purpose we have come to this earth. সদায় মই যেতিয়া বিশেষকৈ ল'ৰা ছোৱালীৰ আগত কথা কওঁ, মই এটা বস্তু বিশ্বাস কৰোঁ যে ভগৱানে কাকো এনেই জন্ম নিদিয়ে, because he has no time to engage in unproductive things. He sent us to this world with purpose. Now it is for us to realize the purpose. If we realize the purpose, we will go back to Him. If we don't realize the purpose, we will keep on coming to this earth till we realize the truth. So this is a cycle of life. Right from Bhagavad Gita, every scripture give us that kind of minimum knowledge that we need purification, and purification in this heart happens with the service to mankind. That is the easiest way. We do not have to take sannyas, we do not have to go to jungle something to meet God, but through constant service to mankind we can purify our soul. Today I am occupying an office. God is kind enough to me where I can do service to mankind. But I am also given certain privileges. But there are some people who are working for the God, who are working for the mankind without privileges. They became like almost they carry the character of the God in this world. I have seen this video, a hospital, renowned surgeon. We know in Assam, I don't want to criticize anybody, but I have seen surgeon who awake up morning at 6 o'clock, do surgery up to 10 o'clock, quickly go to the medical college, come back at 3 o'clock, again they continue in the nursing home from night 10 o'clock. I know many, and I know many people who are dedicatedly servicing for the people of Assam or for the people. All these doctors are highly successful because from the presentation we can realize they are not doing routine surgery, they are doing complicated surgery. And kind of things people are telling about the hospital, these are coming from somebody, at least the people who has narrated their story, they are not complex people, all these are innocent souls. Whatever they have seen, they are just explaining. Whatever is happening, they are just telling us. I am really thankful, I am really feeling fortunate that we got an opportunity to work with this hospital, some great human being, and I am sure that this engagement will continue and we will try to reap great benefit for the poor and needy of state of Assam. It is not only for my state, I believe that in days to come, this MoU will be expanded to various states. Activity of Satyasai Hospital will inspire many to decide at the right time of their life whether we need to continue with our today's professional engagement or we want to do something for the God, something for the humanity. I am sure that this dedicated service will inspire many, and many people, many young guns or young blood will join in the initiative. I have one more request. In Assam, we are very, very passionate about healthcare service. 6% of GDP we invest in the healthcare. A small state like Assam today, we are working in having 24 medical colleges. We want to see all our district hospital goes to the rank of medical college, so that people get tertiary care at the district level. They do not have to come to the Guwahati or a bigger center. Whenever we are got any opportunity to engage with any kind of proactive step on healthcare, we are grabbing that opportunity. Be it with our initiative on Tata Trust in setting up cancer hospital network, be in our initiative with IIT Guwahati to set up a medical college where engineers and doctors can come together, or various other humble initiatives which we have initiated at different levels. I will request Satyasai Hospital also to take some of our nurses and some of our supporting staff of Guwahati Medical College Cardiac Hospital, so that they can be trained with the best level of care, because in my firm opinion, a doctor do surgery for half an hour or 1 hour, but the patient live with nurse and other technical staff for a bigger period. If that period is taken care of, then fatality will always be less. People will go back to home healthy. So in days to come, I'll inspire our health department to work more with Satyasai Hospital without disturbing them much, because they are in a higher goal of the life. They should not be bounded with Assam. But at the same time, without disturbing them, whatever best we can take, whatever inspiration we can take from the hospital, we should keep on taking. Just a word of caution to my department that এই MoU খন কেনেকে হৈছে, আমি কিমান লাভবান হৈছো, আমি পঠাইছো নে নাই পেশেন্ট, I'll keep on a track on every 2 monthly basis. So please make sure that we see only the road of success. We do not encounter with any kind of failure.